But basically the goal of all this, and I alluded to it earlier, is hybrid care. We basically want to think about using the right care at the right time for the right patient. So,
hello, welcome to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Each episode, we bring you a conversation with leaders across the healthcare industry, exploring topics ranging from new treatment techniques and interventions to novel service delivery methods and business models. And now your host, Rafi Salazar from Rehab U Practice Solutions, a leader in patient engagement and retention strategy. Let's explore the possibilities of a new healthcare.
hey everybody, quick housekeeping note before we dive into the episode. This episode was done primarily for YouTube video, so there are slides and references and illustrations that I reference during this audio podcast, and if you want to see those, you can head on over to our YouTube channel. We'll link to it in the show notes, and you can check out the slides as they come up, or shoot me an email, info@rehabupracticesolutions.com, and I can send you some of those slides. Again, just wanted to give you a heads up. Without further ado, here's the episode. Hey there, Rafi Salazar with Rehab U Practice Solutions, and if you want to develop an effective, succinct, and unique positioning strategy for your healthcare business, organization, tech company, you name it, check out the Healthcare Positioning Alignment Workshop. What we do is we basically help you differentiate your healthcare business from your competitors so that you're able to align your solution, your service, your technology, whatever it is, with your targeted healthcare buyer, your economic buyer. And then we help you create a consistent message that drives business in the form of qualified leads, because that's essentially what you need, right? You need people reaching out to you, raising their hand and saying, I want to know how I can work with you. The Healthcare Positioning Alignment Workshop will help you put the pieces in place so your strategy to drive leads isn't a waste of time. If you want to learn more about that, check out positioning.rehabupracticesolutions.com. That's positioning.rehabupracticesolutions.com. And if you want to check out the book, Better Outcomes, A Guide to Humanizing Healthcare, where we outline the 8 commitments or changes that healthcare organizations can make to make healthcare a more human experience, go to book.betteroutcomes.show. That's book.betteroutcomes.show. Okay, this week, we're going to dive a bit into the world of healthcare technology. And what I'm going to do is I'm basically going to walk through understanding like a conceptual framework for clinicians, healthcare organizations, providers, etc., on how to implement technology in a way that not only improves the human connection, but is financially a good decision. A lot of times when we hear this discussion around healthcare technology and implementing tech in the clinic or with patients, a lot of the discussion is about patient convenience. Sometimes it's about provider convenience. Sometimes it's like a cool marketing whiz bang. It's going to differentiate your clinic. But not a whole lot of talk gets put into how do we make this work from a financial model, and what does technology allow us to do as providers to step outside of the traditional fee-for-service healthcare business model. And that's kind of what I want to talk about. So I want to first lay out the very basic definitions, define digital health, what is tech-enabled healthcare, discuss the various ways we can apply or implement digital health tools and the research around the effectiveness of those digital health tools in healthcare. We're going to explore some opportunities to employ tech-enabled services in clinical practice, whether it be telehealth, remote therapeutic monitoring or remote patient monitoring, patient portals, etc. And then kind of have a discussion around the implications and future trends around digital health, tech-enabled services, reimbursement revenue models, and even touch on the AI bit a little bit. So without spending a whole lot of time diving in and getting into the weeds, what is digital health? Digital health is defined, and let me pull up the reference here, is defined by, let's see, this is a 2013 article on on digital health, and it was updated in May of 2023. And basically, their definition of health is digital health refers to the use of information and communications technology in medicine and other health professions to manage illness and risks and to promote wellness. So obviously, that's a very, very broad definition when we talk about digital health. I think a lot of times in the clinic, when the word digital health gets brought up, immediately clinicians and providers, they go to telehealth, delivering hands-on patient care, heads up, synchronous telemedicine visits. But digital health in the term is very, very broad, and it means a lot of things to a lot of different people. And this is kind of the confluence between consumer technology. I know we've talked about it a little bit on the show, but the confluence between consumer technology and healthcare services, and kind of that gray area between a wearable device. When does it stop being, a consumer piece of like a wellness device, like something like a Garmin watch or something like that that's tracking your steps, tracking your sleep, your VO2 max, all of that? At what point does that stop becoming just something that I do for a hobby, for my own personal fitness goals, and become a health tool or something like that? So mobile health, telehealth, all of that stuff. The perceived benefits around digital health is that you're going to increase access. This is all perceived, right? Increase access. You're going to reduce some inefficiencies in healthcare. Maybe you're going to improve the quality of care because you're going to have more data. You're going to decrease the cost of care and allow more personalized or individualized care. So those are some of the perceived benefits of digital health. Now, again, digital health is very broad in the subcategories. This is a non-exclusive list here, but the ones that popped up the most frequently are remote sensing and wearables, telemedicine and health information, data analytics and intelligence, predictive modeling and the like, bioinformatics tools. Medical social media falls under digital health, which it might be something cool to rabbit hole down later. Digitize patient records, obviously EMRs and the like. Patient portals or clinician-facing portals, DIY diagnostics and compliance and treatment tools, decision-making support aids or decision support systems, imaging, and then health and wellness and behavior modification tools. So obviously, very, very broad. We want to speak specifically for healthcare providers, and we might touch on some of that depending on the type of specialty you're in. But for example, medical social media is something that any healthcare provider can engage in. That technically falls under digital health. It is not billable. You're not billing insurance for it, but we can talk about ways to monetize it and the like. Okay, so we've defined digital health. We've defined kind of all the subcategories and how broad of a spectrum it is when we discuss what is digital health. Let's go into a little bit about this innovation, okay? Like what's driving a lot of this. So digital health technology continues to drive innovation across all industries. Healthcare is just included, and it just takes a while for some of this stuff to be mainstream, right? As technology advances between integrations, APIs, and ultimately the convergence of medical devices with connectivity and consumer technology, it becomes more of a ubiquitous thing now, right? Like almost everybody, I've said it, almost everybody's got a smartwatch, almost everybody has a smartphone. They're constantly gathering information on us, and that information can be used by healthcare providers, and sometimes they're just giving us alert. I know I had somebody on the podcast a while back who said they're a runner, and they were finishing up a run. They were training for a half marathon or something like that, and their Apple Watch like pinged them and said, you're having a little bit of, we've noticed a gait change, possibly due to a right knee issue, right? And that's like a consumer piece of technology. It's not diagnostic, not anything like that. It's just the data's there and the algorithms are effective, right, and accurate. So there are, and I'll link it to the show notes, the FDA has a resource page for all of the digital health and regulation, and if you really want to take a deep dive, I'll put that in the show notes. You can go check that out. But how do we apply digital health into clinical practice. Obviously, there's a wide range of uses from general wellness and promotion or health promotion to applications as medical devices, right? So you could have technology that's intended for use as a medical product. You could have technology that's used in a medical product. You could have technology that's used as a companion to diagnostics or as an adjunct to other medical products. Practical applications specifically for, let's say, hands-on clinicians might be the low-hanging fruit that we all think about. Your telehealth, your telemedicine, that's synchronous or asynchronous interaction between clinicians and patients. Tech-enabled care, so either in the clinic or remotely. Remote therapeutic monitoring or remote patient monitoring. Patient portals and communication platforms. Somebody was on the podcast a couple of years ago talking about the digital front door for patients, or the digital patient journey. And that's a practical way that healthcare providers can implement technology in digital health. Maybe it's not directly billable yet, but it is a value add that's going to improve engagement and hopefully improve clinical outcomes and the like, patient engagement and satisfaction. And then again, the digital patient journey, the environment, if you would, of what takes place not just in the clinic with the patient, but in the interim when they're sending you messages, secure messages, or when they're navigating the portal or accessing information, all of that kind of stuff. So as far as the evidence and the research that supports the use of digital health technology or digital health tools in healthcare, there's probably over the last 5 or 10 years, there's been a bunch of studies coming out kind of showing what is effective, what needs a little bit more research. Just a few off the top from a cursory review, and I'll link to all these again in the show notes. But on the topic of wearables as an example, there's a systematic review, a meta-analysis that basically showed wearable activity trackers with patients who were hospitalized. This is kind of a no-brainer. Were associated with higher physical activity levels, less sedentary behavior, and better physical functioning compared to usual care. So basically what they did was they put wearable trackers on patients in the hospital and then track them over their course of their stay. Obviously, even if it's just from a psychological standpoint, if the patient believes they're being tracked and monitored, what that does to behavior, right? How does that alter physical activity and behavior? There was an interesting 10,000 participant longitudinal cohort study that was using digital healthcare for chronic musculoskeletal pain. And it was basically, the results supported the efficacy and the scalability of a digital care program for chronic low back, knee pain in a large, diverse, real-world population. Participants demonstrated a, quote, high completion and engagement rate, and a significant positive relationship between engagement and pain reduction was identified, a finding that has not been previously demonstrated in a digital care program. So basically, 10,000 people were put through this program, and digital health, these digital care programs seem to make a real impact on the perceived level of pain. And what's probably, in my opinion, more important or more insightful or exciting is that the engagement in the resource or in the tool was elevated. I think, especially in the musculoskeletal care space, I come from chronic pain treatment as a clinician. I can't tell you the number of times patients and clients have come back into the clinic for a follow-up appointment, and I say something like, okay, how is whatever it is? Maybe it's a home exercise program, maybe it's a home care program, self-management techniques. How's that going at home? Oh, I'm not doing it, or I haven't done it, or I haven't done it as much as I should. So anything that we can do to begin giving patients the tools, the resources, and empowering them to complete whatever kind of recommendations their healthcare providers are giving them is going to hopefully provide better long-term outcomes than traditional care, where it's like, here's a paper with some exercises, hopefully you do them, right? And then there is, on the AI topic, there is evidence to suggest that the AI models obviously are not where they need to be yet. So there was a study for an AI-based self-management app for patients with neck and low back pain. It was a systematic review, and in the randomized controlled trials that they reviewed, individually tailored self-management support delivered via an artificial intelligence-based app, adjunct to usual care, was not significantly more effective in improving musculoskeletal health than usual care alone. And one of the reasons that they went into that, or one of the conclusions that the authors of that study came to, was that individualized care obviously is more complex when you're dealing with people that have chronic musculoskeletal pain, because at that point you're outside of what they'd consider the normal length of tissue healing, the normal time frame for tissue healing, and there are many confounding factors that could be involved, right? It might be a psychosomatic thing, it might be a comorbidity issue, there might be a real psychological condition or diagnosis that is affecting physiological responses, right? And the artificial intelligence models aren't sophisticated enough yet, maybe, to address that effectively. The other thing that was brought up in that study was that the data is important. The data upon which those artificial intelligence models are based on affects obviously the outputs that you get from that model. And if the data that you use to train that AI model was not representative or entirely representative of the population upon which you're using that model, you're going to theoretically and potentially end up with outcomes that are not optimal, because you're dealing with different data sets or they're not as easily translatable, right? So perfect example is if all the data for your AI model is young collegiate athletes, and then you're going to take that model and you're going to apply it or use it or implement it in a population of geriatric post total hip arthroplasty patients or something like that. Like, obviously that's a very extreme example, but it illustrates the point that the data upon which the model is based is very, very important. And we don't yet have a way of ensuring that it's entirely representative of the population upon which it's going to be used, right? Especially in a situation where you've got like a big metropolitan health system that's dealing with all kinds of socioeconomic backgrounds and ethnicities and genetics and all of that. On a patient engagement and in patient experience standpoint, there have been systematic reviews that show that patients feel more empowered in learning about their condition, in increasing the awareness of their symptoms and their treatment, and feeling more safe and self-efficient, specifically in the chronic musculoskeletal pain space. And that's big. I mean, that's a very big positive. One systematic review on digital healthcare and musculoskeletal pain, the pooled results with substantial heterogeneity showed that rehabilitation using digital healthcare significantly improved pain compared to the control, which is obviously something we would want to have happen, right? You want it to be better than the control. But it points to some of the efficacy of these digital health tools, right? Individuals with acute or subacute musculoskeletal pain, digital healthcare rehabilitation resulted in more favorable outcomes compared to controls. So again, systematic reviews on specifically in the musculoskeletal space have shown at least some indication that digital health tools can have a positive impact and maybe increase clinical outcomes and the like. We haven't talked about the efficacy from a financial or economic standpoint yet, but at least clinically there's a basis to make that decision, right? And that should be the starting point. Is this something that we're going to use with patients? Does it work with patients? Yes, it seems to be supported in the literature that there are areas in which we can deploy digital health tools that can make meaningful and clinically significant impacts on outcomes, and that's what we want. So again, digital health applied specifically in the musculoskeletal space and these last few examples seems to be pretty efficacious, right? The risks from employing it with patients standpoint is technology challenges obviously lead to frustrations, negative experiences, and maybe even a stigmatizing appearance, depending on what's going on with patients not using the solutions, which tends to be pretty standard across the board, right? In fact, there were studies that came out, and I remember talking about this very briefly when telehealth was a big deal in 2020 because of the pandemic. But there were studies that I think it was Hewlett Packard, HP did, on latency in video and audio during teleconferences and things like that. And it was they did a survey of people, and what they ended up discovering in their surveys is that you take one person says the same exact thing, and the only difference between the way it's delivered to the audience is in latency. So maybe there's a little delay in the response, or a delay in the message or the audio and the video aren't synced. So if there's a delay in the recipient or the communicator hearing the question and then answering, for example, or if the audio and video were not synced correctly, the speaker was viewed as more in more negative lights, like less empathetic, less intelligent in some cases, less trustworthy, simply because of the audio visual, the quality of the audio and the video. So that's something to be aware of as clinicians and healthcare providers as you begin thinking about employing digital technology in healthcare in your clinical practice, is that you need to make sure that you're not putting any increased challenges or barriers that might impact patient engagement and the like. So, okay. We'll talk a little bit about remote monitoring here, the evidence for remote therapeutic monitoring, because that's a big thing now. There's a cohort study focusing on RTM, or remote therapeutic monitoring, for wound therapy, and the data does suggest that RTM can be used to influence patient behavior, and there may be a potential relationship between patient behavior and wound healing. So again, that's kind of not a direct causal relationship, but again, we're starting to make the connections for the reasoning behind why we might employ some of these tools. There was a randomized controlled trial assessing RTM's effectiveness in treating early rheumatoid arthritis that did show that telemonitoring does lead to more effective disease remission and more rapid comprehensive disease control than treatment according to conventional management strategies in early rheumatoid arthritis. So again, talk about decreasing the cost for the patients, perhaps decreasing the long-term cost for the payers. Employing some of these tools might be very efficacious in that regard as well. Okay, but why, what's the underlying reason why some of these tools might be valuable or might be worth exploring? Part of it, in my mind, and I've said this for a while, healthcare technology, digital health, all of that kind of stuff really becomes valuable to providers and provider organizations, and to payers as well, and sometimes patients, and even regulators. All the P's of healthcare can benefit from this, is because of the data. The data, or the data, depending on where you're from, is the value driver in digital health. And the reason for that is because it allows you to make two different types of decisions. Business decisions for the organization based off of customer engagement, customer or patient engagement and satisfaction and the like, and then clinical decision making for effectiveness and outcomes, right? Basically, what I like to tell people is that we should think about the data that we get from healthcare technology and the tools that we employ in the clinic as force multipliers that allow us as clinicians and providers to deliver a more individualized patient care or patient experience, if you would, without the extra work that it would take to do it, right? With overburdening the system. So there are some tools that allow, I know Photo is one, that allows clinicians and organizations to track and monitor their outcomes and get very, very granular. You can say, okay, maybe this practice has 4 locations. You can look across and say, okay, for total knee replacements, total knee arthroplasties or something like that, the average benchmark for the nation is maybe it's 16 post-operative visits or something like that. I'm just making these numbers up. So 16 postoperative visits. Maybe there's a clinic in that practice that is successfully discharging patients in 12 instead of 16. And then there's another clinic that's successfully discharging patients in 20 visits. Well, that allows the organization to take a look at their data and say, okay, what is clinic A doing that clinic B is not doing that's causing this disparity in the number of visits? What is that doing to patient outcomes? What is it doing to patient costs? What is it doing to the payers, et cetera? And then you can drill down and make really good business decisions that are going to improve the financial performance of the organization, but then also the clinical outcomes. Because if you can get a patient better in 5 visits less, that's positive for the patient, improving their quality of life. It's positive for the payer because it's saving them money. And you could argue that it makes improved access for the community, because if you're able to decrease the capacity required for this specific diagnosis, it means you can see more patients, right? So healthcare data is, in my mind, the valuable thing that digital health provides. Specifically, we're talking about provider organizations at this standpoint, but you can already infer that payers are going to benefit from this. Patients might benefit from this as well, because they're going to be able to look at their data if they've got a dashboard or something like that to see how they're tracking. Maybe that is a patient engagement tool that you're using, benchmarking a patient's performance to the norms or something like that. And then again, regulators can look at, this geographic region is, using X number of visits for a total hip arthroplasty, and this region isn't. What's different, right? So again, all of the different stakeholders in healthcare benefit from the data, but specifically we're talking about clinicians here. How do provider organizations benefit from the data? The big one is business decisions and then clinical outcomes to improve your efficiency and improve access. Is AI going to replace clinicians? I think the answer is going to be no to this. I know that there have been studies that have come out recently, and one of them said that, quote, patients referred to specialist care might represent a group with more complex profiles compared to those receiving primary care, which could potentially influence their ability to self-manage. That was from the study that showed that the AI model was not more efficacious than standard care. The underlying assumption, though, is that healthcare is ultimately a human experience, right? We want to think about how does technology allow clinicians to do more for the patient, but you still want that human connection being made. I always say it like this, like healthcare is going to allow us to be inefficient in the areas that it matters, right? So think about an overburdened provider that needs to see 50 patients in a day, 60 patients a day, whatever it is. A lot of the burden on that provider is administrative, documenting, pushing through referrals, reviewing charts, all of that kind of stuff. If technology can automate some of that stuff, can provide maybe a clinical summary of the patient's care to date, then the clinician has a little bit extra time to, quote unquote, waste time discussing or talking with the patient, right? That is a net positive for the patient, for the organization, for the relationship between the patient and the clinician, and arguably does very little to increase any overhead. Maybe it even improves billable utilization for that provider. But that's really how we need to think about employing digital health. It's not that it's replacing the human connection. It's that it's allowing more time for what matters in that human connection and removes some of that unnecessary burden or that above and beyond burden that is placed upon clinicians that do choose to spend a little bit more time with their patients, right? Okay. When it comes to implementing technology in clinical practice, I've come up with three different areas in which they can be digital health can be implemented. So the first one is what we'd call the administrative or the continuity or the pre-clinic, the digital front door. So the administrative component of delivering care. Number two is actually in the clinic, whether that be a smart assessment device, smart assessment tools, screening tools, the like. And then the third would be remote for that continuity throughout the plan of care. So Um, let's talk about each one individually. We'll talk about the administrative piece, we'll talk about the in-clinic piece, and then we'll talk about the remote piece. All right, talking a little too much, getting parched here. Okay. Implementing technology on the administrative side. So the big thing here, maybe one of the bigger pieces, is patient portals, electronic onboarding, electronic scheduling, virtual scheduling, and the like. So what is interesting is that 90%, according to the research, 90% of providers offer patient portals, but only, and depending on the specialty, 15 to 30% of patients use those platforms. So obviously, there's a big delta in the investment that's been made into patient portals and the actual utilization. Patient portals and patient engagement platforms represent a potential to improve patient experience and engagement by increasing the bidirectional data flow with patients. So it helps clinicians have a better understanding of what's going on. And it provides patients with, quote, greater access to medical data such as clinical notes. Just anecdotally here, my primary care provider, we use a direct primary care provider. In fact, we've had them on the show before. We'll link to that. And we use Spruce, which is just a secure messaging back and forth. And I can't remember the last time I've actually called their office to make an appointment. Usually I'll send a message and say, hey, XYZ is going on. Do I need to come in? Is this not something to worry about? And either the nurse or my PCP will just send me back a message and say, yeah, why don't you come in at 2 o'clock? Or, this isn't something that we'll monitor it over the next couple of days. Don't worry about it. And that kind of quick and easy exchange of information, one, makes me feel better because I have access to my clinician, right? If I wanted to, I can go in and see notes and stuff like that, see the lab results and all of that kind of stuff. But the reality is, it decreases the burden or barrier to access to care for me. It makes me feel like I'm getting more personalized and individualized attention. So I'm happier with the care that I'm receiving, and I feel like I have a better relationship with my clinician, right? And that all improves clinical outcomes. The same can be said about secure messaging portals in general, or patient communication portals. I know at the clinic, we have like a home exercise program portal that we use with patients that sends them like videos of the exercises they've been given in the clinic, and the patient can message in that app to us and say, hey, I tried this exercise and it's hurting. And then before they come into their next visit, their clinician can log in and say, oh, well, why don't you try this modification? And again, you're just kind of increasing the access and improving hopefully their engagement, but their experience in the care that they're receiving. Now, we struggle too with getting patients to use it and apply it, get onto the platform. But I think we're doing better than 30%. I have to go back and look at the numbers, but it's one of those things that we just have incorporated it into our onboarding process so that patients now are, it's just part of what happens here. So I think there's less of an issue. All right. In the clinic, what ways can we implement digital health and digital health tools in the clinic to improve care? Obviously, there's technology-enabled assessment. So maybe there's a device, for example. I've worked with Squeg is one that is a digital hand and pinch grip and pinch assessment tool. And it basically tracks patients' progress over time, but it can be used in the clinic as both an assessment tool and an intervention tool, which is a nice thing. But there are tools out there. Step Scan is one. I know Tracer, we've had them on the show before. Maybe Restore Skills we've had on the show before as well. But they're all examples of tools that can be used either for assessment or in the clinic as an intervention, and that track data. And you can use that data to either justify, more treatment if you need it, pre-authorizations, peer reviews, and the like, or just to benchmark data for your organization, right? Understand that, okay, we're using, for carpal tunnel releases, the percentage of improvement is X over this many visits, yada, 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 right? So implementing tools in the clinic can be probably one of the lowest hanging fruit for clinicians. If you're going to take, like, how do I begin implementing this stuff into the practice? In the clinic tends to be pretty effective, especially if that tool allows for some remote care as well, which we'll talk about in a minute. But it allows the clinician to work with the patient in the clinic with this tool, this device, this software, et cetera, and ensure that the patient understands how to use it, is benefiting from it, et cetera. And then the continuity piece would be the remote. But implementing it in the clinic tends to be pretty easy and pretty effective because the clinicians are using it with the patient already, and it's just part of delivering care, and it's not this huge extra thing. Which brings us to remote care, right? Like, you can do the telehealth, you can do asynchronous care, you can do remote therapeutic monitoring via platforms or devices. And that piece, the remote therapeutic monitoring via devices and platforms, can be a challenge if the patient doesn't access those, right? If it's one of those, here, take this device home or log onto our platform and we can monitor you or whatever. If it's not done in the clinic, there's less of a chance of the patient actually becoming compliant when they're at home. So it's something to think about. But with remote care, you have telehealth, which falls under or includes both synchronous and asynchronous. So synchronous would be like telemedicine visit, a heads-up display, like a video conference between the clinician and the patient. And then you have asynchronous, things like that, Spruce, secure messaging, and the like. Remote therapeutic monitoring is a big thing in the rehab space, in the musculoskeletal space, which is basically the 30-day window, which we'll talk about in a second. But let's talk a little bit about telehealth versus telemedicine. So, definition of telehealth from the Department of or from the Health Resource Service Administration of the U.S. federal government says that, quote, telehealth is the use of electronic information and telecommunications technologies to support long-distance clinical care, patient and professional health-related education, public health, and health administration. Technologies include video conferencing, the internet, store and forward imaging, streaming media, and terrestrial and wireless communications. So again, that's pretty broad. When we say telemedicine, the same department, the same administration defines it as, quote, while telemedicine refers specifically to remote clinical services, telehealth can refer to remote non-clinical services, such as provider training, administrative meetings, and continuing medical education, in addition to clinical services. So when we talk about telemedicine, we're talking about you're specifically using this to deliver clinical services, clinical care, as opposed to telemedicine, which tends to be a little bit more broad. And that kind of carries us into, like, what are some of the advantages, what are some of the disadvantages of telemedicine in specifically, let's just say, physical rehabilitation, musculoskeletal care. Some of the potential disadvantages are the adaptation of clinicians and patients, or the adaptability of those two groups to adapt to limited treatment options, right? When COVID first happened, or the pandemic happened, and a lot of the physical therapy practices and provider organizations that I was working with were trying to move to telehealth or to telemedicine, and the big complaint they had was, I just can't, patients aren't happy with the care that I'm delivering because I'm not touching them. I can't, do a manipulation or a mobilization or whatever. So it can impact the effectiveness of initial evaluations as well if you're relying heavily on palpation, on end feel, and the like. It is something that can be worked around. And I think what I say all the time when we're talking about telehealth, telemedicine, virtual care in general is that it really just needs to be looked at as a tool to be used to deliver the right care to the right patient at the right time, which means that not every patient is going to be a good fit for telemedicine or telehealth. But it can probably help many patients, right? So it's understanding the use case and understanding this specific patient, even the diagnosis, all of that. So there are tech barriers involved with telemedicine as well, right? Slow internet speed, low audio quality, poor video quality, all of that, right? Insurance coverage is huge too, as well. And then the lack of regulatory structure and organizational support. So we're still trying to figure out what I always say this when we talk about healthcare regulation and licensure and the like. I tend to fall on the side of, I believe, and this is somebody who sat on a state regulatory board for 8 or 9 years, I believe the public would be better served with like a national credential, and remove some of the geographic barriers that happen statewide. I can see the discussion and the merits of both, having a state regulatory agency versus a national credential. But we are in the economy of the internet and globalization, and things like telehealth and telemedicine have really shown a light on some of the limitations of state regulatory healthcare versus a national credential, right? Like now you've got, if I'm a clinician in Georgia, for example, and I have a patient that goes to Seattle, Washington on vacation, I can't deliver services to them remotely unless I pull a license from Washington. And am I really going to pull a state license for one patient on a on vacation for 2 weeks? Probably not. So you could argue that the patient is receiving a disservice, is being limited because of the lack of access there. But it's the way that the regulatory structure is. So there are regulatory barriers in delivering telemedicine that need to be addressed, and you just need to be aware of them as a clinician or an organization employing digital health in your practice. Remote therapeutic monitoring is another area of that digital, or the remote care, obviously. Remote therapeutic monitoring is defined as, quote, "It's a new program in the United States that began in 2022, allowing health or electronic patient-reported outcomes and other patient-generated data to be reviewed by clinical staff between visits so the patient can receive clinical attention as needed." The clinical potential for this, potentially, the potential is potentially big. The potential is huge for clinicians. Specifically, I'm thinking in the musculoskeletal space, who have spent a lot of time doing some of this work anyways and not being able to bill for it. It basically allows you to bill for what we normally do, right? Maybe it's discussing with the patient over the phone their home program. Maybe it's updating their exercise program in the portal. Maybe it's shooting secure messages, all this stuff that clinicians normally do. It just basically allows a bucket for clinicians to bill for that time. So I'm not going to get into the weeds of remote therapeutic monitoring. We did do a podcast on it, and you can go search for that, or I'll link to it in the show notes. But basically the goal of all this, and I alluded to it earlier, is hybrid care. We basically want to think about using the right care at the right time for the right patient. So despite contradictory results, this is from a study here, telerehabilitation in physical therapy could be comparable with in-person rehabilitation or better than no rehabilitation at all for conditions such as osteoarthritis, low back pain, hip and knee replacement, and multiple sclerosis, and also in the context of cardiac and pulmonary rehabilitation. So basically, research is coming out to show that in lieu of nothing, like digital health is better than nothing, for sure. But if we think about how can we use it as clinicians to really magnify our impact, maybe I've got a slide maybe I'll throw up on the screen that really shows what I mean by digital health care or hybrid care. But it's really care that might start before the patient even comes into the clinic, is carried on in the clinic, and then there's time in between visits outside of the clinic where that remote care is happening. And it should all be looked at, again, as a tool in the toolbox. There's ways you can think about this where I'm only going to do this with patients that are billable, for example. I know for us at the clinic, we've taken the stand of like remote therapeutic monitoring, for example, that we just offer that to every patient. We bill it when it's applicable to bill, when it's covered under billable services for whatever payer, or if the patient is going to pay for it, maybe it's a private pay situation or something like that. And the reason we do that is so that it's just operationalized for us, and because we believe it's a higher value of care. You know, if you have access to your clinician in between visits and you have an increased line of communication or improved line of communication, it's going to improve patient engagement and experience, and that's what we want. We want our patients to walk away from the clinic feeling like they've had a valuable experience, that they got something worthwhile from their time with us. So again, we use it as more of a tool in the toolbox. It's just part of delivering care is the access. You as an organization might want to choose or elect to only do it with patients that it's billable for, and that's entirely up to you. That's a business decision you need to make. And that's basically it. I'll talk a little bit here about artificial intelligence, just very, very, very lightly. I know I've already alluded to it, but there was a national survey of Canadian healthcare students and their perspectives on AI. This was in 2022. Overall, 78.7% of these students predicted that AI technology would affect their careers within the coming decade, and 75% reported a positive outlook towards the emerging role of AI in their respective fields. Attitudes towards AI varied by discipline. Students, even those opposed to AI, identified the need to incorporate a basic understanding of AI into their curricula. So obviously, artificial intelligence is something that is advancing. It's here to stay. It's going to get better. The various use cases that were defined in this study could have been like clinical decision-making aids, AI-based assessment tools like motion analysis software and the like, wearables and algorithms that guide tracking, and then AI documentation tools. So those are just very basic ways that AI might make their way into clinical practice, regardless of how hard we resist, right? But the reality is that we want to make sure that we're using it as, again, a force multiplier. What can it do for clinicians that removes maybe some of the mundane or the administrative burden in a way that allows them to spend more time with the patients, because that's really what we want. So basically, in summary, digital healthcare and tech-enabled care and all of that is here to stay. The technology is here. Patients experience or expect it. At some point, payers are going to want it just for the data that it provides. The value lies both in leveraging clinical data and the improved efficiency of delivering care. And then the move towards hybrid care may help clinicians to provide a higher level of individualized care in a sustainable way. And the reality is that like technology and AI won't replace clinicians. What it'll probably do is improve our, hopefully, and I'm very hopeful that it's going to improve our effectiveness and our efficiency, and allow us to treat more patients at a higher level than we could have ever done that before. So anyways, that's just my thoughts on technology in healthcare, digital health, specifically like in the musculoskeletal world. If you want the references, shoot me an email, info@rehabupracticesolutions.com, or go to the betteroutcomes.show website, fill out the form, ask for references for episode 144, I believe this will be, and I'll do that. If you want any insights or things around delivering care virtually, I know I've got videos on this about this topic on the website. I think I did a podcast or a webinar on this topic, maybe tail end of last year, 2023-ish, give or take. And that's, you can find that if you go to rehabupracticesolutions.com under insights. There's webinars and workshops, and one of them is technology-enabled care. A lot of this information came from that. A lot of the studies that I referenced in that webinar I referenced here. And if you want to leave us a rating and review on iTunes, do that if you like the show, or just share it with somebody that you find or that you think would find it valuable. Again, I'm going to make the ask here. We are gearing up at the tail end of 2024 into 2025. We're trying to ramp up our guest lineup. So if you or someone you know would make a great guest, go to betteroutcomes.show and fill out the form at the bottom of the webpage, just recommending the guest or nominating the guest or filling it out for yourself. And we'll be in contact. If there's a topic that you would like us to cover, again, betteroutcomes.show, drop us a note. Until the next time, folks, be safe, be healthy. I will talk to you then.
Thanks for listening to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Our hope is that you walk away from each episode informed, equipped, and empowered to push the boundaries in your own practice or business. We want to give you the tools to help you build strong, long-lasting relationships with your patients and clients, helping meet their goals, improve their health, and achieve better outcomes. Learn more at www.rehabupracticesolutions.com. We'll catch you on the next episode.
Thanks for listening to another episode of the Better Outcome Show with Rafi Salazar. This episode is brought to you by Strata PT. Strata PT is a single EMR platform and revenue cycle management service for physical, occupational, and speech therapy practices that helps you achieve a 99.99% reimbursement rate. If you'd like to learn more about Strata PT and see how their EMR and RCM works, head over to stratapt.com to book a demo.